Good morning. As nearly 3 million doses of coronavirus vaccines are delivered around the country this week, the most ambitious vaccination campaign in American history has officially begun. The imminent arrival of vaccines for our healthcare workers and our nursing home residents is a beacon of hope at the end of a very challenging year. The first batch of vaccines is the initial step towards a goal of inoculating enough people to halt the spread of the virus that has now killed nearly 300,000 Americans, including 1,200 St. Louis County residents. The speed at which this vaccine was developed and approved showcases the eminent talents we have among our scientists who have forged extraordinary relationships and cooperation to get us to this point. Despite this incredible pace, we know it will be well into the spring before enough people have been vaccinated to stop the spread of this deadly virus. We do not yet know in St. Louis County exactly when we will have doses that our Department of Public Health will be giving to the nurses and other healthcare workers in our clinics. We continue working with the state, who is tasked with managing the vaccine rollout. We are confident we will know more details in the coming days. The county's health department has installed ultra-cold freezers so that we can provide a safe place to store the Pfizer vaccine once it has arrived, a vaccine that was developed right here in St. Louis County. We will be informed when the hospital's joint distribution system in the St. Louis region has vaccine in hand. The hospitals will work diligently to get their critical first responders to COVID-19 patients vaccinated. Our healthcare workers have been heroes during this pandemic, and getting them protection from this virus will help them continue their incredibly challenging work. Meanwhile, pharmacy companies such as Walgreens and CVS will work to get those vaccinated who work and live in our long-term care facilities. The vaccine distribution process is going to take time. Once the first round of vaccines is given to our healthcare workers in nursing homes, the next round goes to first responders, teachers, and child care providers and other essential workers. There is no timeline on this as of yet, and it is dependent on how many doses the state is given and then further distributes to counties. We stand ready to work as quickly and as safely as possible to get the vaccine out to the public. Our Department of Public Health is working on a community outreach plan, which includes making the vaccine available to its 35,000 patients. Once the plan is finalized, we will get that information out immediately. We have come a long way, but this journey is far from over. We put in place aggressive measures in St. Louis County, including one of the first stay-at-home orders in the country back in March. As the largest county in the state, and with the first recorded case in Missouri, we moved swiftly to slow the spread. Throughout the pandemic, we have had to make difficult decisions, all with the health and safety of residents in mind. Lack of a federal response and no uniform response across the state left us to do what we had to do to protect our residents. 4 weeks ago, we put into place a new safer at home order. Our hospitals were stressed, and they remain stressed now. The number of cases and hospitalizations remains too great. A month ago, I said we would keep close tabs on the data, and we have. There is simply too much of the virus in our community to lift this public health protocol today. For the next 2 weeks, our public health department will continue to work closely with the pandemic task force. While the numbers from our hospital systems are no longer at record levels, they remain way too high to consider removing any protocols that could jeopardize the lives and result in a devastating setback in the work of our community. So please stay at home unless you must leave for work, school, or a medical appointment. We strongly urge older adults to have groceries and prescriptions delivered. Wear a mask at all times when not in your home. And please limit gatherings in your home to 10 people or less. Support our restaurants with pickup, drive-through, or delivery. Indoor dining will remain closed. Our health department is working with restaurants to find a path forward to open indoor dining safely. Many restaurants have reached out offering to help. Thank you for your ideas and your efforts to help us be a better and safer community. Once again, I plead with the federal government to come together for the better good of the whole country and to approve a stimulus package to help our families, our businesses, and our communities make it through these next few months. We need help from our federal government. We need a statewide mask mandate. and we need, in our community, universal compliance with all of our public health orders. The continued spread of the virus is a direct result of some people not doing what is best for everyone. So please do what's right. The virus is still raging. It will not stop just because the vaccine is on the way. Questions?
Dr. Page, from Channel 4, if the cases have gone up in St. Louis County, does that mean the restrictions didn't go far enough? Does it mean they weren't coming from indoor dining?
Question from Channel 4 about the cases and what they're doing in St. Louis County. The cases have begun to plateau over the past 3 or 4 days. We're not quite sure this represents a trend. We are hopeful. We need to see this trend go in the other direction and start to decrease, and we need to see the hospitalizations start to decrease as well. We do believe that this possible plateau that we're seeing now is a result of the restrictions that went into place 4 weeks ago and the change in the behavior of most of the folks in our community, socially distant, mask wearing, and our other precautions. We do know it's well established in science and with recommendations from the CDC and the White House Task Force that indoor dining does contribute to the spread of COVID in our community, and the restrictions that we have in place were the right thing to do.
And from St. Louis Public Radio regarding the virus and the county finances, the council will likely pass a budget bill soon. What are some of the takeaways from that budget, and what had to be cut because of the fallout from the COVID pandemic?
So the question from Public Radio about the budget that's before the County Council and that will be taken up tonight for consideration of final passage. There are several budget bills, and we'll wait and see what the council does with those budget bills. They certainly have the ability to make changes if they determine that that's necessary. Once the council has adopted the budget, then we'll have a better understanding of the outlook of the financial picture for 2021. We did ask some of our departments to make some cuts, and some of them have done so. We did not make cuts or recommended cuts in public safety or our health department. In fact, our health department will dramatically increase their footprint in 2021 in response to COVID-19. At this point, I don't anticipate the need for new revenue in the way of property tax. We do hope that as our stimulus package comes together from the federal government, that there will be relief for state and local government across the country. Our nation is facing the same challenges of all of us, is that the potential of declining revenue from sales taxes could impact our budget. So far in St. Louis County, the impact on sales tax has been minimal.
Just 1 second. Looks like we might have. What help is there for real estate tax assistance for those in businesses that are not able to operate at a restricted level?
Yeah, there's some questions about real estate taxes for businesses that are struggling, and that is a very difficult proposition. All expenses for all businesses that are struggling moving forward. It's going to be a very difficult question, and I do hope that we see relief from our federal government to help with all of those expenses, rent, unemployment insurance, unemployment for workers, and any sort of tax liabilities, that we will see some help from the federal government to help bridge that gap. This pandemic has certainly been devastating for businesses and for individuals, for employees in general sense, dramatic loss of life in our community, stress on everyone, frustration for everyone. And we realize that this has been a very difficult time in the history of our county and the history of our country. And we're excited that the arrival of a vaccine marks the first turning point, but we are a long way away, several months away from seeing a relaxation of our restrictions, like wearing a mask or social distancing. And we do hope that we see some relief from the federal government soon. Okay, thank you.